Thank you for listening to today's episode of Medical Device Global Market Access by Pure Global. Today we are examining a remarkable market access success story in the United States. The transition of continuous glucose monitors, or CGMs, and insulin pumps from niche technologies to mainstream medical devices. This shift illustrates how regulatory and reimbursement strategies can fundamentally alter the landscape for a device category. The trend became undeniable by 2022, as data showed that the number of unique Medicare and Medicaid beneficiaries using CGMs had climbed steadily every year since 2017. Crucially, this growth reflected a broadening of clinical adoption beyond early adopters. People with type 2 diabetes now outnumber type 1 users among these beneficiaries, a clear signal of mainstream integration. The primary engine behind this expansion has been insurance coverage. A pivotal moment occurred in April 2023, when the Centers for Medicare and Medicaid Services, or CMS, significantly expanded eligibility for CGMs. The new policy removed prior restrictions, opening access to anyone on any insulin regimen or those with a history of problematic hypoglycemia, which refers to dangerously low blood sugar events. This single policy change made millions more adults eligible for the technology overnight. Consequently, public insurance uptake has risen sharply, with one recent analysis showing an increase from 41% to 58% for this group, and commercial health plans have largely followed suit, creating powerful momentum. As we look at the market in 2025, the American Diabetes Association has documented continued growth in both access and patient choice. The U.S. market is now a competitive ecosystem of multiple CGM platforms, with companies competing on features like longer sensor wear time, factory calibration that reduces the need for traditional fingerstick tests, and enhanced connectivity with smartphones and other devices. At the same time, hybrid closed-loop insulin pump systems, which use CGM data to automatically adjust insulin delivery, continue to advance, further integrating these technologies into a single system of care. When you combine the policy tailwinds from CMS, constant improvements in sensor technology, and the rise of data-driven care pathways, it is clear why CGMs and their associated pump systems have become arguably the most popular day-to-day medical devices in the U.S., measured not just by sales, but by routine use across primary and specialty care, including within underserved populations. If you need assistance with global market access for your own medical technology, we invite you to check out Pure Global. For access to our free AI tools and database, please see the link in the description. Thank you for listening, and we'll see you next time.